Professor Mezzich, you created the person-centered medicine, the person-centered psychiatry. What could person-centered psychiatry address for our contemporary problems and challenges in psychiatry training in face our very important difficulties in clinical practice today?
Thank you for the question. I think we should recognize that person-centered medicine is not a specialty, but is an attempt to cultivate the fundamentals of medicine. And therefore, what is medicine all for and all about is the subject of person-centered medicine. Given that, as we know, historically, all civilizations have cultivated health in terms of a holistic framework and personalization at the same time. And also considering that life is the main subject of health, and that is why we need to keep in mind historical and philosophical basis for medicine in order to be able to revisit person-centered or to revisit person-centered medicine in the direction of its fundamentals, namely the person. They say in WHO that if one wants to promote an ethics project, they have to be person-centered. If it is person-centered, it is ethical. If it is ethical, it is person-centered. So I think that is a very important thing in general, and also for training purposes or any other aspect of healthcare. And then what is important, I would say that on one hand, it's very important the cultivation of the person, and also the system in which we practice, namely the health systems that are fundamental in order to be able to practice medicine in the way that it should be practiced. And then that we should be very attentive to the well-being and the general health of all health professionals who work there, in the same way that, of course, we have to consider that the promotion of health and well-being of not only patients, but people in the community, who are also, why we are devoting ourselves to medicine, is important. So more specifically, I think in terms of educational aspects or strategies, I think that in addition to paying attention to the health system, the educational system, it is, I think, important to have a program of education that is very careful in the very dedicated to the promotion of these perspectives from the beginning, from the selection of the students and the selection of the professors, and then to have as one of the main activities educationally, mentorship. I think that is very helpful, and it is, I think, growing around the world in medical schools, for example, so that we can accompany the student throughout his career, not only to promote technical and scientific and professional skills, but also human development. And this is important for the student, but also for the professors who benefit as mentors in this exercise of accompanying our students throughout their careers.
Okay, thank you very much.
Thank you very much for your interest, Professor Pereira.